Good evening, everyone. My name is Ashanti Carter, and I'm the program manager of the Rodham Institute here at the School of Medicine and Health Sciences at the George Washington University. It's good to see you all. So, today we are going to have a dynamic conversation about balance training. But you already know how we do it. You know how we start our webinars. I'm going to share a few words about the Rodham Institute. So, once again, welcome. Stay tuned, you guys. So, remember, I told you this is our kickoff to our aging series. So, stay tuned because Tuesday, December 8th, from 6 p.m. to 7 p.m., we will be discussing the aging brain. We have Dr. Christina Prather and Alicia Bailey from the East River Family Strengthening Collaborative. So, this is a conversation that you just do not want to miss. Now, December 15th, we're going to talk about healthy eating for blood sugar control, strong women stay young with Dr. Lottie. And of course, we're bringing back my girl, Miss Percita Moore. January 12th, we're going to wrap up our aging series on Live to Be 100. What does it take with Dr. Louisa Whiteside and Nurse Fiona Drury? So here we are with the Rodham Institute. We believe on one struggle with many fronts. In order to achieve health equity, there are so many things that we need. That includes social justice, economic justice, and legal justice. We were founded 7 years ago by Dr. Jahan El Bayumi, as what we affectionately call her, Dr. Gigi. Awesome, awesome woman. And she believed, and her former patient, Mrs. Dorothy Rodham, believed that education is a way to achieve health equity. And so that's a little bit about Rodham. We have three priority areas: youth education programming and workforce development, training current future health professionals in applied health equity, and of course, what we're doing now, community collaboration. We do have a great website, so check out our resources, our COVID-19 website. So if there's anything that you need, please take a look. And of course, this work cannot be done without our wonderful staff. That includes Ms. Tracy Bass. She's the Director of Health and Workforce Pipeline Programs. Ms. Christina Williams, who's not only monitoring our Facebook live feed, but she's the Director of Community Engagement. Did you know that Ms. Williams has actually helped to feed over 1,000 people in the district? She's also helped to deliver over 2,000 masks for those who need them. And of course, you know me, Ashanti Carter, Program Manager. And in our fearless leaders' absence, hi, Dr. Gigi. So let's keep in touch. Those are our handles on social media. Follow us on Facebook, you guys, but don't just follow us. Leave a comment. We need that algorithm going, you guys. Make us official. Follow us on Instagram. And if you have anything to say, email us. So now to our panels. I'd like to introduce to you Dr. Tania Alchalabi. She is the Assistant Professor of Medicine for the School of Medicine and Health Sciences, as well, which is located at the George Washington University, and Ms. Percita Moore. But since we're still here, I want to give them their respect and read their biographies. So if you will please indulge me. Dr. Tania Alchalabi is an assistant professor of medicine who has been with the GW Medical Faculty Associates since 2013. After her residency in family medicine, she did her geriatrics fellowship at GW and later joined the department as a faculty member. Her particular interests in geriatrics are memory and post-acute long-term care. She co-directs the Geriatrics Outpatient Memory Clinic, provides mentorship to geriatrics fellows, medical students in outpatient and transitions of care arenas. She also teaches preclinical courses in the School of Medicine. She has published about transitions of care and is an active participant in clinical research about memory disorders. Now on to Ms. Percita Moore. So Ms. Percita Moore is an acclaimed health, wellness, and fitness entrepreneur at Bodies Inc., where she works extensively within the digital, entertainment, and medical sectors. She has over 2 decades of experience and hundreds of successful client stories of reaching their health goals. Ms. Moore served as executive director of a wellness program at a large hospital in Los Angeles County that served older adults, many with comorbidities. The clientele of Bodies Inc. is diverse in ages, which include youth and older adults, as well as professions that include students and the Hollywood elite. You go, girl. Percita's approach to overall health success is to keep your purpose in front of you. She takes a holistic approach to help clients achieve their health goals, which are mental, spiritual, and physical. Success in health is intentional, and her intentions are always successful. So, welcome, Dr. Alchalabi and Miss Percita Moore. All right. Someone said that they're having trouble hearing us. Can you hear us, please? Okay, good. You can hear us. Perfect. All right. I just want to make sure that we're all set. So let's jump into the first question. Dr. Tanya, what is balance training?
Well, good evening, everyone, and thank you for inviting us to this hopefully very lively conversation. So, balance training, it's doing exercise that really strengthen the muscle that help keep you upright. They could be like leg exercise, it could be your core strengthening exercise, and there's so many different types of exercise you might heard about that can help with your both pose and balance. Some of you might heard about yoga, Tai Chi, and other types of exercise.
Okay, that's great. So this question is for the both of you. Why is balance training important for aging successfully?
Um, so let's think about it this way. Fall, as we all we worry about it, as we get older, we start worrying a lot about falling. It does happen as we get older, but it's not a sign of healthy aging. It's not a normal part of aging. What is normal part of aging, for example, that you might start having some arthritis, like wear and tear to your joints. You might start having some changes happening to your vision, to your hearing, to your sensory input, which is when you put your foot on the ground, how that messaging get transitioned to your brain. That all can be part of aging, but the actual fact that we tend to fall as we get older, that might be related to some reversible at times causes. That's why we need to identify that, and we need to work on our balance and training, our core strengthening early on to prevent that from happening, because there is no, in other words, it is good that we sometimes be like, okay, you fell last month or 6 months ago, let's work on your strength and gait and all of that. That is all important, but it's more important to identify that this must be kind of a lifestyle to prevent things from happening, prevent weakening of certain muscles.
Thank you. That's a great answer. Do you have anything to add, Percita?
Well, I mean, I believe that coming from the fitness aspect of imbalancing, it really is identifying where your core is. I mean, when we think of core, we typically talk about the stomach because that's all we know, right? But when you think of it from a skeletal perspective, it actually is the anterior and posterior. So it's the front of you and the back of you. We don't tend to think of that. So we engage ourselves in waist training and things like that to aesthetically look proper, but you really want to understand it starts from proper breathing. So Dr. Tanya identified things like yoga and Tai Chi, and those are awesome, but I always stress that in order to keep your core strong, you really need to add weight training in. It's absolutely impossible to keep it with just what you would call more of a meditative, extensional stretching type movement. Tai Chi and yoga do identify breathing, but the funny thing about it is actually you actually breathe in those two exercises the opposite way as you would actually breathe for fitness itself or resistance training. So I try to have my clients do it all. It's really important to have balance across the board. You want the resistance because you want to understand that your bone density is important. And as you get older, there's absolutely no way around losing the density. The more you are aware of keeping the density alive and really staying as, you know, on point as you possibly can, it makes it so much easier to then sustain as you get older and be a little bit more aware of what your body is doing, more so than, you know, just not being aware and waiting until it's not a preventative measure, it's actually a necessity. So it is something that we all should actually take heed to way before, you know, we hit an age bracket where we need to look for assistance or feel as if we're in the geriatric platform. We want to actually do it and do it right away. Right. So in my 40s, it's something that I'm already identifying to be able to do. I've been doing it for 20 years. A lot of my clients come to me in their 40s and in their 50s, and they feel as if, you know, this is something that they want to get in touch with their body now. You just put up a picture of a 80-year-old Black bodybuilder female who started in her 50s and absolutely wanted to just have something to do. But we really want to be aware, as the doctor is saying, that it's something that you want to start early. And it's something that can be prevented if you take the necessities of what you need to do now, you actually heed to them and move forward. So that's what I would say.
Right. And that actually led into the next question, which was who should engage in balance training? And you said it, people in their 40s. What about Dr. Tanya, maybe people who have fallen?
Yeah,
Should
so it's never too late to start working on certain things. But what I emphasize on when people started falling already is that should take more like intervention. It should the this is a question between the patient or the care partner or family member and the provider. First is identify the risks. Yes, I've fallen 6 months ago, 3 months ago. Let's talk about it because now it's becoming an important topic, more important. And then you do talk about balance and training, but also a key component is to sit and do investigative work. Why did it happen? Let's think. What other factors are leading to this fall?
Yes, that's great. That's great. So thank you for that. So Persita, what's your approach? Because as Dr. Tanya stated, there's some investigative work that has to be done. And we know with older adults, they still want to be independent and so forth. So, Persita, can you tell us about your approach to helping older adults to get that balance training?
I mean, I think what we fail in regards to our seniors as a whole in society is that we really stop treating them as if they're important or if they have purpose, right? So, what I've learned in my experience with seniors in particular is that they just don't feel as if they have a purpose. They're not really heard. People are, you know, kind of overlooking what they're saying and what they're feeling, not necessarily the best bedside manner from some doctors who don't really listen, but actually read more of what they think the patient should be doing. There's not an understanding in the family on how important it is to you actually communicate in a level of what they can understand, not what you have time for. So what I've always noticed is a lot of seniors really come or they would come to the gym and really express to me they didn't feel appreciated. They didn't feel as if they were connected, almost burdened to their family. So I think some of that comes with just the lack of connection to what is happening in the world. Some people really shelter them off. Having a caregiver is awesome, but having one person, only one person that comes to see you every single day to try to make sure everything is good, they don't really have the ability to have a bad day. because a senior, that's all they have, that's all they want, that's all they're looking for. So what she's saying is very true, but it's a really personal interaction with them, to not really put them in a position of just kind of like, you're older and figure it out, and I don't really know, and I'm really tired of you falling attitude, but more of an attitude of purpose, and really letting them know that they're still here and they want to be active, because typically I believe they do, right? So it's just really finding that way to get everyone on board to understand it's crucial and crucially important on how we actually interact with our seniors. They're like children. Words matter, conversations matter, a little time matters. You'd be amazed at how much they look forward to things as they get older that we just don't pay attention to. So I think it's very emotional. I think it's very, very connected with like what you really want out of life, and just giving them that.
Yeah. Do you mind if I may ask something to what you just said, Percita? That's a great point. I think one of the things we can do as a patient-provider relationship is to normalize the question. The more you ask about it and express to the patients why we're asking, because a lot of my patients, for example, told me in the past that I don't like to mention the fact that I fell because I'm worried about what's going to happen next. I don't want to talk about it because that would worry me. Or like, I don't want to, like you mentioned, be a burden. I don't want my family to be worried about me. So if we start as providers, normalizing that conversation, and it's going to be part of every visit, and explain why you're asking these questions, that will open up the gate a little bit about, okay, it's a normal conversation. I talk about different things with my doctor, and this is part of it, and explain why you might be concerned. And there are ways, it's not like a doom, and there are ways of how we can make this better and improve outcomes. Maybe that might help both ends of getting more engaged.
Yeah, I agree with that.
Yeah, that is great. That is great. Now, looking at COVID-19, that we have almost a quarter of a million people who have lost their lives behind COVID-19. And I know when it first came out, it said, well, hey, our seniors are really vulnerable. So as a result, a lot of seniors are staying inside. Some people have said, you know what, I feel like a prisoner in my home. So our seniors are isolated. What can we do, Dr. Tanya and Percita, even though a senior is still in their home, what can we do to make sure that they're still active and they're maintaining that balance training?
When we say seniors, I don't like, we have to think about their functional level, because not all 65, 75, 85-year-olds are the same, just like any of us. We have different functional baseline. So for example, like if we have a healthy 65-year-old who lives independently somewhere in the community, I've tried to have chats about, do you have access to a computer? Can you walk around your house safely with a mask on? Do you have access to some Zoom fitness kind of activity? Is that okay? How do you feel about it? Because yes, there are things available and the patient might have that access, but they don't feel good about it. So it's important to address that with them. How would you feel about joining a class online? Is that something you're interested in doing? So that would be at one level. Then we have to think about seniors with different functional level. Maybe living in assisted living, maybe living in long-term care. Then the conversation will change. Do they have access to, for example, physical therapy? Do they have access to occupational therapy? With the COVID era, I've had very mixed information coming from different patients. Some of them told me that, I fell, but where I live said no physical therapy. It's not essential at this point. And It opened a big conversation about what is essential and what's not. But other senior residents in DC said, no, we still have access and we feel safe performing some sessions one-on-one or virtually with a physical therapist. So again, it all depends on their baseline, and it all depends on what we're looking at. One of the things that some of my patients told me in the past, that they felt lost when the physician tell them, do exercise. And they will sit and be like, what exercise? What am I supposed to do? What is safe and what is not? What is helpful and what's not? So if the provider doesn't feel comfortable, or don't have the enough information to share about what exactly you're recommending, it might be time to engage someone from the community, or maybe referring to physical or occupational therapy to have that conversation to make sure that the patient is getting the true benefit of exercise, and not because they might be doing something which is great, but it might not be what is needed for them at this point.
That's great. Thank you. Do you have anything to add, Percita?
I mean, I think I would also add the baseline position is a very strong, I would say medical fact, right? You really have to have the ability to be able to be active. You can't just randomly say it. So I have an 82-year-old mother who lives alone and is extremely active, but this has caused her depression because of the fact that activity has nothing to do with the fact that even if you are active and you're used to being active, now you're finding yourself in a depressed place, same as you would as a 20-year-old, because the things you used to do, you don't do, and change is very complicated. So when you're talking about COVID, outside of even the baseline, you actually have to deal with how do you handle things that you normally could do? How do you wear a mask for a long period of time of 20, 30 minutes? That's a long time. For me, I can't stand it. So I can relate to the inactivity threshold of where most people that are in the community and society as we speak as a whole, of how to actually get going. So I think we'd actually have to deal with that fact outside of just the premise of what's really happening. Can they be active? I don't want to be on Zoom every day, what I mean? And I'm nowhere near in the level of saying my capacity to get on and off, it would be my mother's, right? There's plenty of seniors who are extremely active and still don't have any access to the computer or can barely understand what it is. So there's just this disconnect of trying to normalize things that aren't normal that I think is a little crazy right now, because you can't really shift in an environment that is continuously shifting and no one really has answers on what to do, what not to do, how much time out, how much time in, what are you doing? It really becomes almost to me a place of really enjoying it in a carpe diem mindset. Every day, you just want to kind of wake up with just the thankfulness that you're up and this trying to find something to do, be it, exercise with the chair or walk up and down your stairs or stand on your patio and feeling good about you're not losing yourself within it. Right. So I think that's the issue. That's the disconnect. When everyone's talking COVID, we're still not addressing the fact that none of us have an answer at all. So it makes it very complicated to direct anyone to do anything when it's shifting so quickly. Right. So I feel for the medical industry because it's very complicated. They're supposed to know everything. Right. That's like what it is. How exactly are they supposed to know everything when even they themselves, who've spent years, trying to figure out what's happening, have no connection. So I think it's very hard for not, as she said, not only the seniors that are active with the baseline, that's fantastic. They're used to being out and cycling, to the person that's in the care center who, is now around individuals in management and staff who are themselves scared. So I think that energy of just the unknown is really driving people crazy. And I just stress for anyone that I'm coming in contact with, is it's a daily journey. We're so used to planning and being able to tell ourselves what we're really doing. It really is a daily approach to really trying to figure out what you want to do. Some days you want to move, some days you don't. Some days you want to just lay in the bed. I tell my clients, lay in the bed, lift your legs in the air, take a deep breath and just be thankful for it. It's enough for you to be able to decompress the body so that it does not have all of the disconnects of what society is doing right now. So That would just be my take. I think what the doctor is saying is amazingly factual in regards to people don't really understand the word senior is not just, incapacitated people. I mean, it actually is something different. And if you, again, are losing yourself and just trying to figure out how much longer, right? Like, where are we? What are we doing? There's really no way to approach it with anything other than a day-to-day approach.
Wow, that was amazing. Thank you so much for that. So, just calling up our loved ones who are older and just talking to them, maybe that's what we do. Or, hey, mom, have you walked around or do you feel like walking around the house today? Is
Or
that appropriate?
or just the affirmation of telling someone that you love them, and this too will pass, right? At some point you want them to be here for you to be able to say something nice to them. It's something that we all need. We all have a moment where we need it, but when you're in a place where it's just you and you're already in a space of really not knowing what your life is going to be because you're in the latter years, it's crucially important to take the time just to say, hey, I really want to see you. Graduation is coming. Regardless, I want you to be able to be there. You just have to push forth some sense of purpose into everyone, right? And that age bracket is crucial. It's just crucial.
I love that. I love that. So, changing gears just a little bit. Um, I wanted to ask about older adults who have Parkinson's or Alzheimer's. They're especially vulnerable to falls. How would you go about helping them with their balance?
I'll let the doctor start.
Okay, thank you. So again, we have to identify that this will be a problem early on. So, for example, I can see someone in memory clinic very early on concerned about memory changes. Yes, the gait is okay. Yes, the balance is okay. But we start talking about the mechanics of it, how this will affect your whole body, not just remembering things or recalling things. So when you start opening that topic with the patient early on about what might be happening, and let's prepare, what do you think you might be interested in doing to improve functional level in general? What would work for you individually? What is your support system? Some people tell me, I love walking, and but with all what is happening with the memory and the Parkinson or the Parkinson, it's harder to walk. Okay, let's individualize that. Let's talk about what you can and do and who can be with you. Enjoy that walk, and it's safe for you, and it's meaningful for both. So that is a one thing. Two, again, I cannot emphasize, in my opinion, about the importance if we do identify a change in the way someone is walking, needing some help with balance, needing maybe an assisted device like a durable medical equipment. It is really important to refer to the physical therapist and occupational therapist early. Why? Because if you are using a cane or a walker or you're needing one, it is good to know which one to pick. What is good for you? What is good to maintain a good posture and not create other problems because of using the wrong equipment? And also, they might help us, or like we work together, whether again that's with the therapist, whether that is with the trainer, anyone. What is like a very individualized way of approaching that individual problem and gait problem, and then take it from there. But again, for Alzheimer and Parkinson, I think that intervention should start extremely early.
Thank you. Anything to add, Percita?
No, I think that that's spot on. I mean, in regards to really finding the therapist who actually is taking the time to not identify the individual as just a number for the day and actually paying attention to what they need and how they need, crucial. most people that I've interacted with in the, decades that I've been playing with this is more in a position of not really enjoying the medical approach, right? I mean, when you're talking about physical, people are vulnerable. So it's a different type of a vulnerability than would be if you were in the hospital itself. I mean, even I have some sense of anxiety once, you hit the doors, you just don't know, right? I mean, the doctor could say anything and you feel good, but they say no. That part you're used to, but what you're not used to is contorting your body in a way that you have to be vulnerable enough to express what you're feeling. So I've always tried to get everyone to use music. When you're talking about memory and you're talking about things of that nature, it's always been identified, and studies have been shown to actually identify music as being a key attribute for the senior population that would be in that sector, to be able to actually identify where they are and what they're needing to feel and how they can actually express themselves better, because it's a two-way street. The therapist or the trainer, whoever, cannot communicate with someone unless they're communicating back. And it's a very different bedside manner to actually physically touch someone and really try to express what's happening at the right time. So for me, what she said is key. I mean, you would be amazed at how many people don't get the right equipment at the top. So when they then come down through what they think would be the end of their therapy, they're starting a whole new thing. Now it's a hip, was a back, now it's a hip. Was it a knee? Now it's something completely different. So I would say putting that with, getting them engaged in something that they like and make it a little lighter so that they can actually want to do it instead of feel as if, they're going to go through the anxiety again, is all key. It's all key.
That's great. So there's a question that came in through the chat that's on this actual topic. And the question reads, what do we know about connections between body health and brain health, especially as related to dementia and Alzheimer's?
So when we think about dementia, I like to look at it as an umbrella. Alzheimer is only one kind of dementia, but there are so many reasons that might lead to forgetfulness. So back to your question about the connectivity. So for example, if I'm diabetic and I have very high blood sugar levels, and I will start being more physically active, controlling my diabetes better, eating healthier, following a healthier lifestyle for my diabetes, that would lead to better outcome for my brain cells and lead to hopefully less chance of me having memory loss because of my risk factors. So it is connected. Now, back to Alzheimer particularly, do we know exactly what caused Alzheimer? Not really, but we do know that certain factors contribute to better brain health. We know that if you have better control of your diabetes, blood sugar, blood pressure, cholesterol, if you lead a healthier lifestyle where you're physically more active, yes, that would lead to better outcomes and it reduce the chances of memory changes.
Thank you. Thank you so much. So I have another question for you. Now, this is about nutrition. We spoke earlier about preventing falls. What can we do with our diet and nutrition to prevent, falling down, just making sure that we're balanced and healthy? What can we do?
Okay, so that's a very good question. So let's think about osteoporosis. If someone has osteoporosis, which is thinning of the bone, that per se that should not lead you to fall more often. But if you fall, there's a higher chance of breaking a bone. So this is where osteoporosis comes from. So if someone is diagnosed with osteoporosis, then I should think about good calcium and vitamin D intake, about weight-bearing exercise like Percita mentioned earlier. That would help. Then if I think about, okay, is there a particular diet that would lead to more balance, like better balance? That I might not be the expert to answer that, but we do know that healthier diet that can lead to healthier heart, healthier brain, and healthier muscle. Less red meat, for example, less cholesterol, less saturated fat, more on the omega-3 levels, diet that is rich in calcium and vitamin D, and that doesn't have to be meat-based. There are a lot of other sources that would lead to better bone health and muscle health, and that might contribute to reducing the chance of falls and imbalance.
Anything to add, Percita?
Well, this is where health and fitness kind of bump heads, because for me, even though what she says I completely agree with, honestly, across the board, you really have to be aware of what your body needs. I mean, the problem to me with the health aspect and trying to give, let's just say something like the DASH diet, right, is that it's not individualized, and everyone's system is not going to respond properly with that.
Hold on, Percita. What's the DASH diet?
DASH diet would be something that would be more of a diabetic kind of high blood pressure type scenario, right? So when you usually have your level, I mean, and correct me if I'm, if I'm not explaining it right, Dr. Tanya, but it's more of something to really keep your hypertension levels down. Your salt typically is under about 2,000, is it milligrams? Is that right? I don't know what the M is. I can't remember. But needless to say, it's under the standard 3,500, right? So you look at it, because I'm not a nutritionalist, so let me be clear. It is definitely, for me, something that I just think is just too general when you're talking about it in the health aspect. And when you're really trying to exert certain energies, if you're doing, resistance training, if you're completely active in regards to your lifestyle, as far as active stuff, we're not talking about walking, because, the Surgeon General would tell you the 20 minutes of walking is healthy. I, as a trainer, would tell you that that is not enough, because there is typically the average person who says, I'm going to walks at a pace that does not increase their heart rate. And they're then telling themselves that they can eat anything because they actually walk. So then the doctor is confused, because the average patient comes to the hospital and they never tell the doctor the truth. Absolutely never do. So it's the most comical place where I feel like I need to walk in with each individual person to say, you can't even get the proper information from the health professional if you won't tell them what's really happening, right? So it's a tricky place. I don't really think it's something that you can just blanket statement and say. I think it's something that you really have to be conscious of your individual lifestyle, specifically. Like, what are you doing? Are you actually working out? Are you really only trying to, go into a fast because you want a flat stomach? I mean, what are your intentions? Because there's a lot of things that go along with that, right? And as we get older, we have the misconception that we're Instagram and we want to be that girl, and that 20-year-old who has no children or no realness to what's happening. And I'm not mad at her, but I'm just being realistic and saying, you really have to be in a place of truth. And I think the health industry really does not quite understand that, to just give someone a blanket statement of do this and this is what's required is actually hurting, just the credibility of what it is that people will do or say. The average person just kind of stops and says, I don't really have to eat meat, but as she's saying, you still need some sense of protein. But most of us don't really even understand what the vitamin does or what vitamin does what, right? And we won't ask, because that would mean we're telling the doctor truth of like what we're really doing, right? So there's this, it's a weirdness that I think it just stems from, the person that really wants to fix it against the person who has given up, or the doctor who's actually taken the approach of that it's irreversible. All of that plays a role, because it just depends on what the environment is for the person. So my hope today even is that we all understand that you really have to be honest with the people that are trying to help you. And you really have to be honest with yourself to say, am I really going to do what's required? Otherwise, this whole conversation is crazy.
Yeah, it's not going to work. Did you have anything to add to that, Dr. Tanya, or no? Okay, another question came in and it's right on point with what you stated. So what opinion do either of you have on intermittent fasting, and would you recommend the practice to someone older? And what about exercising while fasting? I've heard of that.
That's a great question.
I'll let you go first, because that's interesting.
Thank you. So every few years, there's like an influx of a new thing, a new diet that will be the answer to all of our problems. Now we are living the intermittent fasting world, right? So I've asked a lot of people who come in for various reasons interested in intermittent fasting. It could be from a patient who read that low sugar levels in your brain are actually good for your brain cells and it's good for the memory. I've heard it from people who are interested in weight loss and struggled with like 30 different diets in the last few years and nothing seemed to work. And of course, there are people who are interested in general for health reasons, like they want to stay healthy and fit. So my answer always is there is nothing magical about any diet you follow. We have to have a balance. We have to think about what is your lifestyle? What are you trying to achieve? Is it achievable? What are the risk factors? And how are you going to do it? What's your plan? Because intermittent fasting for someone like a friend of mine, he would be fasting for 16 hours straight and he feels fine, but he hikes weekly. Might be different from someone who's starting and diabetic and I'm worried about their blood sugar levels. So yes, I would start by asking the patient, what is your understanding of intermittent fasting? What are you trying to achieve? And maybe we can work around it so we can achieve a better, maybe blood sugar levels. And yes, if it works for you, great, but let's figure out how it's going to work. And more importantly, because most diets, they do well, whatever diet you follow, you might lose, if the idea is losing weight, you might lose a few pounds early on, but it's how to maintain a healthy, like long-standing change is what matters. And again, what are your goals? And we work together. And also, it's not only important because you want to build that relationship with your patient and have a trust relationship, but it's also important to ask details about whatever diet they want to start, because a lot of patients and a lot of people in general might start using over-the-counter herbal things and new things that if I don't ask about it, they might not mention because it's not a prescription medicine. It's not something that the doctor needs to know about. And that might interfere with medication or with the new diet that they're trying to use. So it's really important to sit down and have that open conversation. And at some point, if the physician feel that I don't think I'm comfortable or I have enough knowledge to answer questions, is to know whom to refer to, whether a dietitian or a weight management clinic. But it's important to identify where your comfort level is as a provider and then refer appropriately.
Anything to add, Percita?
Well, in regards to intermittent and, more the fitness industry, I don't think the average person understands that bodybuilding as a whole profession has kind of skirted its way into the mainstream American society. So a lot of things that people are actually thinking are newfangled have been around for years, right? And it has absolutely nothing to do more than with the aesthetic of, we're now in a society that's completely caught up on how you look. So the average person, again, they're not coming to the doctor to be honest. The doctors have no idea what you're talking about, and why it's even a part of what you're trying to do. Also, the average person does not have the stamina nor the consistency to fulfill it. So you really have to identify what your intentions are, which is what she's saying. So you really have to know what it is you're saying, but because it's not something that you can just generally identify. Intermittent fasting came along with other things in the industry of fitness that most aren't willing to do. So you kind of got to know the history of it before you just jump into it. Do you feel great with it? Of course, you're starving yourself. It's absolutely impossible to not feel good about wearing a pair of jeans that you wanted to wear. The question is, do you understand that there's a balance? Even if you're referring to a bodybuilder, they cannot dehydrate their bodies for months at a time. There's an off and on season for a reason. You hear the term, you don't really understand what it is. There's pounds that are put on. There's phases that you have to go through. But yet again, we're in a microwave society where people want things and they want them quickly. The average person that is intermittent fasting is not doing it for any other reason than to lose weight. You don't really hear it for just the general person who's like, oh no, I feel fantastic. Unless it's something more on a, I would call it more of a religious background or something of that nature. The most I've ever seen is for performance. A lot of people feel as if, you know, they really only need this one ginormous meal and they'll give themselves time to kind of burn it off. And again, you don't really know what your organs are doing. You're not really going to the doctor as often as you should. So there's just no way to do anything without the funny part of what this whole conversation is, which is balance. And balance is more than just the falling. It's, you can fall mentally and not understand that it starts in that capacity so that Dr. Tanya can help you physically. So there's a lot of things. I just don't think we want to address directly. We kind of play all kinds of games with what we are really asking. And the truth is, intermittent is not for the average person. It's not even for the person who wants to do intermittent, because again, you can't really do it for a long stint of time. You have to actually know when your time is to do it and when your time is not to do it. And you have to know your history of health. So if you don't go to the doctor, it's impossible for you to know that, which makes it very impossible for the doctor to help you. So you'll be back in the hospital with kidney failure and all kinds of extra things that you did not think would be that deep. And when she's saying over the counter, it's always things that are center-based, right? No one talks about that. But everyone thinks if you're pooping, that your stomach's flat, right? So you have every tea on the planet to try to tell you that you want to suppress your appetite, not understanding that it's a consistency of eating that actually keeps the body flowing and it keeps you in a position where you don't really gain the weight, right? So again, it's a hard place for health because it's trying to keep up with fitness and, you know, and marry within the two. And there's just a disrespectful line, I think, that rides between them that doesn't make it very easy for a person to communicate, because the average doctor disrespects the fitness industry to say like, well, you know, that's nothing, you don't want to do that, and it's killing off your body. And you have more people that are now leaning that way. So somebody like Dr. Tanya has an ear and she's actually paying attention. But that I can't say that for most people that I've interacted with in the medical field. Their opinion is so strong, it makes it complicated to hold the conversation. And in the same breath, their patients aren't really being honest. So if you catch what I'm saying, the balance comes with all of that, right? It comes with all of those things being a part of the facets of what you bring to the table.
That is awesome. Awesome. So I hope that person, you got your answer. So you both touched on something and you talked about the mental. So I want to know from the both of you, how do you get your patient or your client, like after falling, there's a mental consequence. There's something mental that happens. For you, Dr. Tanya, can you describe it and then talk about how you get your patients back active? And then Percita, what do you do with those clients who have fallen?
So the mental part is very real. Fear of another fall is very real. And I don't know if our participants or like anyone in the panel fell before, but regardless of age, you have sometimes 2 weeks, more, less, of not being aware of how to take the next step. You want to hold on to something, and that can really affect your next level of function. If I continue to be scared of walking, crossing the street, I will not cross that street. And that would lead to, again, changing your lifestyle, changing your habits to try to accommodate and not go through that fear. So that will eventually affect your overall health. So again, an approach, we address it, we normalize it. Like I share with my patients that it must have been, traumatic. Tell me about it. How are you feeling now? Not only physically about soreness, but how do you feel? And then back to our first question, try to identify risk factors, whether it is within something that the patient is having. And once they have that, you have that sense of control that, yes, let's sit down and identify what could have happened so we can change the things that we can change, or something outside environment. Was this something at home that we need to work on? Was this something related to the lighting? Was this something related to the shoes you're wearing? Or is this something physical, like eyes, like the sight, hearing, the way you walk? Let's talk about it and then have a plan. But again, first identify that the fear of falling and the consequences are often not talked about, and they are very important to identify early, so you help the patient get out of that mode and that phase and try to engage in something meaningful to that patient. And I, again, individualize the care as much as possible, because what might work for Mr. Jones is different that would work for Mrs. Brown. It's different. So try to individualize it and identify what would be the risks early on.
Percita.
Well, I definitely agree with just the identification of what exactly happened, right? I don't think you can fix anything if you're not really aware of where you're starting, what happened and where you're starting. In regards to anything in life, if you're falling, you have to actually understand that you were moving. So there's some positive in the fact that you were actually doing something at the time that hopefully you would have then fallen down. And getting past the fear is just simply, you're not deceased. You're not giving up on yourself. It's just a matter of really healing within to understand it's something you can fix. It's something that you are in control of. We focus a lot on things that we're not in control of, but falling, when you're in that space, you really have the ability to fix it no matter what it is. And you do not have to worry about anyone's opinion other than yourself. So if a client comes to me and they've had some type of a hiccup, right? Let's just say from a fall to their diet shifted, or, they had an eating plan and they weren't on it. My point is that it happens. Everybody does it. Everyone has the issue. You're not alone in it. So there's no reason to beat yourself up about what it is. Stop, figure it out, make it happen. It's equivalent to me to eating. If you burn something, you're not going to stop eating. You're going to figure out a way to either recook that or find another meal you can cook. So you have to approach everything with more of a positive approach instead of telling yourself, well, I don't want to hurt myself. And I hear it a lot. I mean, people will say, oh my God, Percita, my back is completely ruined. And I'll say, you don't have a bad back, you have a bad stomach. And they look at me crazy and quite don't really understand what I'm saying. But if you catch skeletal, the skeleton is the skeleton. There's a bone that is in a circumference. There is no back to front. So if you kind of catch what I'm trying to tell them, is like, it's all cohesive. It all goes together. So if you have a bad back, you have a bad stomach and vice versa. So work both of them instead of really, again, focusing on what you did wrong. Forgive yourself, move forward, focus on what you're doing right, do more right than wrong. And then you can actually get through it and start all over again.
Wow, that is wonderful. Well, in the last few minutes that we have left, I have one more question for Dr. Tanya, and then I'm going to close it. I'm going to turn it over to you both for last remarks. So, Dr. Tanya, we know about COVID-19. things are happening, and then of course there's a flu season. What advice would you give to older adults and even their caregivers about the flu shot?
So I might be a little bit biased because, again, I'm a geriatrician on one hand, and I'm a mother of two, and I see how terrible the flu is for younger kids. So it's like double whammy. Um, I've always been someone who recommends the flu vaccine for everyone. This season or this year, it's more important because when COVID started, I've heard some people telling me, well, if you can get either or, you don't get both. That was the initial like thinking, was like, we know you get one virus at a time, and there is no such medical, like there is no such fact. So your lungs will suffer, may suffer, may not suffer from a virus that is affecting mainly the breathing and the lung. So anything you can do to prevent further damage to the system is great. So if we are exposed to the flu and have symptoms and feel terrible, and then COVID on top, on a body that is already tired and fatigued, and the immune level is not so great, that is not a good scenario. So yes, I do encourage the flu vaccine for all of my patients.
Thank you so much. So now, closing remarks. I'll start with you, Percita.
Well, I mean, I think for me in this entire conversation, I just really hope that people understand that you can't be helped unless you're willing to be helped. And you have to really find some line of respect across the board for everyone in the participational sector that's trying to help you, right? So in order to keep your core straight and to keep your entire life balanced, you really want to understand what's working for you and what's not working for you, and really hone in on those things and do more of them. Honesty is crucial. Going to the doctor is crucial. Paying attention to what they're saying is crucial, because we all have this thing where we try to identify ourselves as our own doctors, right? Because we know us better than anyone. And to some degree, you can use that analogy, but not for everything. So you really want to give the health profession the respect that they deserve and move forward. Same with fitness. You can't come to me telling me what your doctor said from a medical place, because I'm not a medical person. So you have to know who you're talking to for what, and not utilize us against each other, because we have enough divide. And in order to be balanced, we just have to really focus on building that up from the core at a younger age, so that as we get older, it actually makes more sense and we can actually feel the way that we want to live, which is positive and strong and empowered.
Thank you. Dr. Tanya?
Um, I want to share with you all that ageism is there. We have a lot of certain ideas and ideologies about how a 65 versus a 70-year-old should be like and function like, and that is not true. It is our role as providers, as community, as patients, to educate the world that it is not the age, it is my functional level or where I stand health-wise, balance-wise, and what are my preferences in life? How do I want to live the next year or 20 years ahead of me? That is very important. And also when it comes to, again, back to our topic about balance and functionality and inner strength, it is important to understand that we all are at different levels. And for those who might not be able to express their feelings, whether due to physical or due to memory changes, there are always ways where we can identify those needs and try to work with the care partner into reaching a better functional level. There's always a better functional level. It might not be the same for all, but the goals might change, but it's good to identify what can be done.
Thank you so much. This has been a great conversation. And I would like to thank you, Dr. Tanya, and you as well, Percita, for a wonderful conversation about our healthy brain and live long with balance training. So on behalf of the Rodham Institute, standing in for Dr. Gigi El-Bayumi, thank you guys and be well. Woo! See you next time.
Thank you.